wellness revolution starts now.
Welcome to the show. Today we're going to be discussing health and wellness with the newest member of our team, Gabrielle Foppe. She's a physician assistant with a very interesting background that we'll be talking about, and I'd like you to get to know her better. And I'd like to start off by asking, you went to the founding osteopathic school in the United States, which is a very interesting perspective. Tell us about what you learned from that.
Yeah, so my education started by attending University of Missouri, is where I got my bachelor's degree in biology. And then from there, I got my master's of physician assistant studies at the University of A.T. Still, which I went there, got my master's degree, and the unique thing about A.T. Still University is they combined not only conventional medicine, but also a more holistic osteopathic approach and mindset. Mm-hmm. So our education actually had mind, body, and spirit classes worked in throughout, and a lot of other PA schools don't get that. And so I think that's what really made it unique. And they also made a strong focus for communication and interpersonal skills, and just showing that a provider isn't just about the clinical knowledge you hold, but the importance of that social and emotional intelligence that's required to build those everlasting relationships with your patients. So that's what made that school really stand out. And as you get to know kind of a little bit more about me and my background, you'll understand why I kind of went that route more than the just conventional PA school route. So from there, I did my clinicals actually in Wichita Falls, Texas. And so I did 8 clinical rotations, anywhere from neurosurgery to behavioral health, family medicine, or pediatrics. I did them all. So that has made me into a very well-rounded, seeing the whole person, healthcare of it all. So
Great. Yeah, no, osteopathic medicine is something I was impressed with when I was in the Air Force. I worked alongside with a lot of osteopaths, and I was always impressed. One thing I noticed is that in medicine, where there's a lot of emphasis on disease. In fact, I know that my license, my original diploma talked about I had a license to diagnose and treat disease. What was absent from that was there was nothing about health. Nothing about promoting health. Tell me about how your philosophy, particularly from your osteopathic roots, tie into actually changing the concept from finding and treating disease to promoting health.
Yes. So I think during my clinical rotations, the one thing I constantly ran into with patients was that they always expressed how many symptoms they were having on this long list of medications that they were on. And most of the side effects were the symptoms they were presenting with. And so what we're taught is to find a disease and match it to that medication. And that medication is really just either suppressing a certain pathway or suppressing their own immune system from reacting. And so I felt I was doing a disservice to my patients when, they would approach me with all these symptoms and concerns. And so that made me open my eyes and be like, the body is naturally healing and wants to heal itself. So why are we not allowing it to do so? So that's when my mindset kind of made that switch from finding disease to truly focusing on how we can heal and reverse those imbalances. So
Great. Now, you had an issue when you were born that kind of colored the way you perceive health. Tell me more about that.
Yeah, so my mom always likes to say I was a problem child from the very get-go. So at 13 days old, actually went into cardiac arrest. And so I had to undergo emergent open heart surgery.
Wow.
So I had coarctation of the aorta and a bicuspid aortic valve. And so I was always kind of under the doctor's watchful eye growing up. Can I play sports? Can I not with my heart condition? But I never felt like a sick kid. My providers were my heroes. I looked up to them. I wanted to be them. And so they were the ones that really showed me that, how powerful medicine can be if it's delivered with compassion and empathy and I really hope to give that same experience to my guests moving forward. So
that's wonderful. That experience didn't make you go the opposite direction.
no.
That's very good. The whole idea of natural medicine is based on some of the principles you were talking about from osteopathy. Can you tell me more about how you kind of think about how to have a sustainable, natural way of living out health, approaching life?
Yeah, so I think my aha moment with approaching more functional health and wellness rather than the conventional route was actually in undergrad. I became really ill with a GI bug, or what I thought at the time to be a GI bug turned into something a lot more serious. And for about a month, I couldn't keep any food in my system. I dropped to 85 pounds. I was in and out of doctor's offices, the ER, and shocker, all the labs, all the scopes came back normal, and they just threw medication at me that honestly made me feel worse. So with my own background in medicine at that time, I decided to take matters into my own hands and to find a different approach, whether it was lifestyle, nutrition, and also just nervous system regulation. So I was implementing those things in my daily routine, and I finally healed myself. And all the doctors were like, "How did you do that? What did you do?" And then when I told them the basics, lifestyle changes, they looked at me with like confusion and didn't understand. And so that was really my aha moment, showing that lifestyle changes can do what a lot of advanced medicine and diagnostics mostly can't. So
that's huge. And I think most of us who get into this area actually have a similar experience, either concerning ourselves or about a loved one in our family, where we realize, wow, if I had stuck with my original way of thinking, we would have never gotten out of this mess.
Exactly.
And then when you tell what you did to your colleagues, they kind of give you either a blank look or actually kind of a condescending. So it's getting a little better. Now, as you think about the idea of being healthy, one of the things that you were talking about in osteopathy is connecting with people. And people often, similar to what we were just saying, don't really feel heard, I think in part because a lot of these concepts, they just don't really get taught well to a typical doctor going through medical school.
Right.
And the idea of listening and hearing people is so important. Can you tell me more about that in your philosophy?
Yes, of course. So I've been the patient that's been dismissed. And I know how that erodes trust. And I think once a guest experiences a similar situation, they stop seeking help until it's an emergency because they lost that trust in the whole system. So that's why it's so important to me from the very first encounter I have with a guest is to listen. And once they feel like they are being heard and understood, then that's the start of their healing. So I think that's really important to give to them. And also just by making sure they're an active participant in their health is really important. It's like the saying, you can lead a horse to water, but you can't make it drink. Same with guests coming in. I want you to be excited about your health. I want you to want to make those changes. And through education and making sure you're involved in the plan, I think we can see like longer lasting results. So.
It's so interesting that the art of medicine includes that therapeutic relationship. And that's not something that I think most of the time, by the time you finish your training, you think your main job is to write a prescription.
Right.
And that's not what people need. It was. I remember I had a chance to interview a long time ago, Dr. Peter Bregan, who's a great psychiatrist who's never written a prescription for a psychiatric medication in his career. And he talked about that therapeutic relationship and the power it has. And I think that's definitely our goal is to have that relationship, because everybody knows what it's like to be encouraged by that teacher or coach or somebody. And you're like, man, that person transformed my life. And they didn't write a pill. They didn't write a prescription.
Yeah, they didn't.
Sometimes when you're talking to somebody and you're trying to figure out a plan, you hear them talking about things and you're thinking about ordering tests. How do you combine comprehensive functional medicine tests with what the person in front of you is telling you?
Yes. So labs don't show the whole picture. They show a snapshot in time.
That's right.
So I use labs more as a useful tool to kind of confirm what the guest is already telling me. But my main priority is talking with the guest, getting their story and listening and making sure that I'm validating their symptoms and making sure that they know their symptoms are real. And that is my main priority. And the labs come second.
Great. Yeah, it's often true that if you only listen, if you only look at the labs, rather, you'll often miss some things that are subtle. Anybody can see it when a lab's way outside of the range.
Right.
And it's remarkable that we've reduced medicine to this very simplistic model.
Exactly.
One of the things that I found that the cookie cutter medicine can sometimes come into play when you start thinking, okay, if you have fatigue, this is the drugs. If someone's depressed, these are the drugs. If their cholesterol is high, these are the drugs. And it's largely just based on this is the protocol for doing it. And there's, it's good ideas to have some general ideas of how to approach it. But can you tell us more about how you would want to individualize medicine for the folks you're working with?
Yeah. So any two patients that walk in the door should never be treated the same. They can have the same diagnosis, but at the end of the day, they have different triggers as to what's causing their symptoms. So I think individualized care looks like, to me, is having those deeper connections and asking those harder questions and getting to the root cause, and then forming a plan based on that individual's goals, their lifestyle, their biology, and really personalizing it to them.
Okay, very good. And of course, since every person is unique, there's always going to be a unique interaction of you in that therapeutic relationship. That's fantastic. There's a lot of things that are different about what we do here and even our environment. What is it about working here that excites you thinking forward? Yeah.
So from the very first time I came here, I felt very welcomed. Everyone was so nice and positive to be around. And I think a lot of people experience the same. It's not your typical doctor's office that most people dread going to. You feel a sense of relaxation when you come in. And so that's different from anything I've ever experienced. And so it's also the people that work here. I mean, everyone is so genuinely excited about what they do every day and about helping people. And you could just see the passion in what they do. So I think that's what excites me most. And I think in a time where we are right now, there's a lot coming to light, and a lot of people have questions and are demanding answers. So I think we're going to see this change in healthcare. And I think functional medicine is just at the beginning and is going to see a big spike in growth very soon, if not already. So I'm excited to be a part of that journey and obviously learn from you and everyone else here, as I know I have a lot of learning still to do, but I'm just excited to be here.
And you're very quick you learn very fast. It's very exciting. And when you think about it, you're talking to some people right now that probably have been in various situations. They may have been unheard. They may just be frustrated because that one doctor can send them to another doctor who sent them to another doctor. And they're just doing this merry-go-round thing where everybody's basically saying, that's not my thing, that's not my thing.
Exactly.
Or they've been treated by people and they're just not getting anywhere. What might you say to encourage those folks? Yeah,
I would say you're not alone. And there is help out there for you. I would say don't be afraid to ask questions and question the status quo. Maybe you need to get a second opinion, a third opinion, a fourth. But don't ever settle for, something you don't agree with. So advocate for yourself and really get involved in your health and know that a provider will work with you to provide quality care and not just tell you what to do or what not to do. So I think that's really important for them to understand.
And I think in the functional medicine world, one thing that's encouraging is rather than thinking of, is this disease treatable, we're thinking of, can you work to get this person back into balance?
Right.
And you almost always can move in that direction. And typically as we get people in better balance in their, whether it's hormones or vitamins or other aspects of their health, things start improving themselves. And
exactly.
so I've really grown to the point where I rarely see a condition where I think, well, nothing can be done for that. And obviously, the earlier you intervene, the better.
Right.
But it's great to know that you're a part of this team, and I look forward to our guests getting to know you.
Yes, I look forward to meeting them all. So I'm glad to be here.
Great.
At Physicians Preference Pharmacy, we specialize in compounding bioidentical hormones, which means that all of our hormone medications are made right here on site in our compounding labs. The term bioidentical means that the hormones in the products that you're taking, whether that's in a capsule, a tablet, or a cream form, are chemically identical to those which your body produces. So your body responds the same way it would to its own hormones. This is important because hormones work in the body as a lock and key system. Just like your front door, only one shape of a key will fit the way it should to unlock that door. And the same goes for how hormones work within your body. For a medication to be the most effective, with the least number of side effects, we must give your body something that it recognizes as its own. And this is why we choose bioidentical.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.